Thank you, thank you, thank you, thank you, thank you. I appreciate it. Thank you.
Please explain to everybody what metabolic syndrome is all about, because I really don't know either. And I always say, I'm not going to take any of it.
Okay. Thank you very much. Thank you, Joyce. Thank you. You're so special. Thank you. Well, I don't know. Oh, I know she wanted me to say another honor. Okay. Well, I also received a call in November from the Congress that I was nominated for physician advisor, physician, what do you call it? Best Physician Award or whatever they call it. And I think I have it with me. And anyway, then I said, okay, I will accept it. And then in February they said, you won it, you won the award. We'd like you to come over to Washington and have the dinner with President Bush and the Congress. And I was with, among other physicians from around the country, and I have no idea why they did that. Because I disagreed with him about many policies. However, I am a believer in it doesn't matter if we are one family, one country, under one God. It doesn't matter how much differences we always have. We always have to come to unity after disagreements, and that is the main thing. And divisions also always destroy societies, you know. I just like Bill to tell me when to start, so I was given exactly 80 minutes. Because we're going to put that on CD and DVD, and so it has to be exactly 80 minutes. So I had an alarm right here to warn him, but I'm going to depend more on him than the alarm. Metabolic syndrome is, to talk about that, it's really the most important group of diseases we ever discovered in the history of humankind. Those group of diseases was discovered about 10 years ago. We have discovered something that we've been looking for about 100 years. We didn't know what's going on. But I wanted to remind the people who have heard me 25 or 30 years ago, when I came to lecture in this area, that I have, predicted there is something behind these diseases we have. And right now, we have seen tremendous number of people died from different diseases. I want to show you a map of the world again, just like I showed you in the past, because metabolic syndrome lies within this map that you have seen it in many lectures before. This is the world right here, and if you're from India, don't get mad, your country's there. If you're from Japan, don't get mad, your country's right there. If you're Irish, you're right as big as England, so so I made you bigger than England. So in any way, when I came to United States, after I have finished my PhD in nutrition, and I tried to get a job in my field, pharmacognosy, and I find out the field is closing in Davis. I went to UC Davis, and this is closing, Berkeley's closing, every place is closing. Then I said, well, then I just either go to another country or just change my field. So I came across, during that time, when I'm in the process of doing the pharmacognosy, is basically studying plants and food and soil. What's good in it for us as human, for supplements, what's good in it as medication, and what's poison in it, and all this stuff. And also, so during that process, when I was trying to give lectures to the public about that in different places, I came across Dr. Shaklee, and I met him, and we discussed it. And I wanted to tell you, if we look at the world we find that the world that has got industrialized, industrial revolution started in England and in Germany and in Italy and places like that, came to the United States. That's the industrial revolution. And those countries managed to have cars and airplanes, automobiles, and become wealthy and all of that. And after they became wealthy, they make guns and cannons, and then they start moving across the world and invading other countries, include United States, and then going around the world and seeking new territories, with their weapons. Millions of people died in the process, but that's the way ignorance of human history are, and we should not repeat it. These people got so wealthy, and then suddenly they start having diseases that's eaten through them, and with the wealth of the money they have, they figure they're going to destroy every disease. They're going to kill every disease. You remember when Reagan says, we will beat cancer in 10 years. When this president comes, we will beat AIDS in 10 years. We'll do that in 10 years. We did that in 10 years. We haven't succeeded in any of them so far. So at that time I said, why? What is going on? So let us get to the root of the problem and see what's number one killer disease in the industrialized country. What is it? The heart disease and vascular diseases, coronary artery diseases, okay? 1 million die every year. And we have not made any progress in that. We made new surgeries, new medication. We have not improved the quality of life of heart patients that much at all. There is little improvement here and there. You can put somebody in a nursing home 10 years longer or this or that. It doesn't mean the quality has improved. Are you following me or no? Then they start fooling us and telling us when we complain, but our lifespan is getting better than those people in the poor countries. We believe that. Then I came to this country, 1968, and I said, I don't believe it. Because they are calculating the babies that are dying in those countries from typhoid or malaria or cholera with the older and averaging them, which, when they die from cholera or malaria, they die by the millions, And that was the idea. Add them up and divide them, and their average lifespan was 40 years of age. Ours started becoming 50, 60, 70, 75. Oh, gosh, we must do something right. No, we did not do anything right. Because our children got antibiotics, they had no cholera, they had no pneumonia, they had no problem, and that's why the number went up. Are you following me or no? It is not because the older got better. Actually, we have sad news. I just came from San Diego, which for the last 4 months, I attended probably a tremendous amount of conferences with my colleagues around the country to discuss nutrition. We had our first American Nutraceutical Association meeting in the Sheraton Hotel in San Diego, which we started at 25 scientists, medical doctors, and now our first convention was 200. And we all got together and we discussed the scientific research. I met doctors there and my colleagues in the group that be working 30 years on omega-3. Another one being worked 30 years on beta-carotene. Another one working 30 years on vitamin E. You can't believe what we met. Just people, you think I know these people 10 times better than me. But we all as a group complement each other. So in this situation right here, we find out that heart disease is not gaining. Number 2 disease is cancer, is growing up, right or wrong. And number 3, diabetes, hypoglycemia, metabolic diseases gaining ground tremendously. And 4, depression, hormone, and all of other things. If we look at these diseases here, they kill 70% of our population. And everything else kills 30%. Are you following me so far? 70%. What are the people which is 80% of the world is not industrialized? I do thank God they are not industrialized. Because they're lucky and we're the unlucky one. Why? What do they die from? Infection, right? Number one killer. What's number two killer? Still infection. Number three is still infection. And number four, poor malnutrition from lack of protein. Not their fault, but the fault of their own dictators, that they don't give them food. But what's the big difference between their problem and our problem? Their problem is curable. Our problem is not curable. Are you following me or no? We spend billions of dollars on heart disease, billion on cancer, this and this and this and this, and we keep going from hitting walls, and you probably know the whole story. We ignored lots of things. So I came with the theory that time. I'm taking you back to 30 years ago, 25 years ago, and I said, I made the triangle, the famous triangle I made in 1968, and I said, the cause of diseases has to be nutrition, or stress, or toxicity, or combination of all. You remember that, some of you, or no? And I said also, not only nutrition problem cause disease, and stress cause disease, and toxicity cause disease, we have another problem called synergism. Nutrition problem cause more toxicity that cause more disease. And toxicity problem cause poor nutrition that cause more disease. Nutrition problem cause more stress, like lack of calcium and all of that, that can cause more disease. Stress can deplete us from vitamin antioxidant that can cause more disease. Toxicity can cause stress, like ADD and all the, you know the story about it. Stress can cause toxicity by creating free radicals. So it's all intermingled, and I came with the solution, 68, by saying, okay, what happens if we eat better protein, carbohydrate, fat, vitamins, water, mineral, and fibers? What happens if we have better control of stress? What happens if we have detoxification? What happened to us? Then I came across Shaklee supplements, and then meet Dr. Shaklee, and then I started prescribing the proper vitamins, the proper protein, the proper fibers and things like that. And I started practicing medicine, became a medical doctor. Then I became an internist. Then I became a cardiologist. But in the meantime, I maintained my job as a farmer still all that time. So my job was 50% medicine, 50% farming until today. Every single day I pass by the farm, see the crops, see this, see the animals, see this, check the animals, and go check the people, because that's just equal. So in any way, these diseases, we succeeded through this guessing process we went through, all of us, because we didn't know much science. Did we have enough blood tests to tell us deficiencies? No. Is any blood test now accurate enough to tell us deficiency? No. Do we have machineries to tell us everything about the human body? No. We have to use common sense and say, yes, stress causes problem. Yes, chemical causes problem. Yes, these food supplements are very important for us. Then, by 1996, by 2004, year 2000, Stanford University came out with the idea that these diseases, I want to go backward a little bit because I went ahead of myself. In the meantime, those times when we said all the diseases were going up, If you remember those days, we said from 1800, remember that, to year 2000? Anybody remember these curves? Or you remember we said 1800? I was guessing 1800 that time, taking it because that's as far as back we can go and record. But the word 1800 is going to mean more tonight. Then we said to ourselves, could it be that from 1800 until today, we had more toxins in our food? Could it be we had more sugar in our diet? Could it be we had more processed food and white flour in our diet? And then we said, could this cause this? And when I put those two curves together, I was arrested in Richland Center, Wisconsin, for saying that. I said, how can you say that? How can you say that having sugar, having this will cause some of these diseases? That's unbelievable. That's not true. And I told the guy who's arresting me, I said, go to hell. I don't care what you say. Because as far as I know, I came for freedom to speak what I say, and if I don't like it, I just go to Brazil or Australia and continue my research. So, in any way, he lost and I won. So, this diseases right here, we notice it is to have a relation to toxicity of sugar and flour, white flour and bread and things like that, plus other things. We don't want to dilute our time. Then we have also other factors involved that we're not going to cover tonight, but we cover in the next lecture. That is, air pollution went up, water pollution went up, and chemicals went up, stress went up, all this went up. Can this also cause more diseases? Can this, in combination with the high sugar, cause more diseases? Okay, and we discovered something, and that was my discovery, not me and Dr. Shaklee, basically the only two, that we just said, maybe the people are deficient of vitamins. Maybe they are deficient of protein. Maybe they're deficient of vitamin C and vitamin E and vitamin B and beta-carotene and flavonoid. Maybe they are. So maybe if we give them these products and they are sick, right there, if we give them this product, maybe their disease will go away or improve. If you remember, Shaklee 68, that time, 69, they had a guarantee that if you take the Vital E and the protein, we guarantee you if you don't feel well, bring it back. Right or wrong? Did Dr. Shaklee have every scientific tool under his hand that time to tell the future? No, but he had a common sense, he had a vision. I had a vision too when I had the same vision. All people with brains have visions. And then we decided to say, okay, if we have deficiency of protein and vitamin this and this and this and this, and we add it, and we're going to get better, what happens if even improve the stress and toxicity, we're even going to be better? So that's how nutrition become a very important part of my practice since 1976. Now, by 1996, it started that in Stanford University, we discovered that there is a disease called syndrome X. And the word syndrome means multiple diseases. And X means we don't know. Okay, that is what it means. It's also called metabolic syndrome. And lots of people jump on the wagon and start writing books, which I read all of them. And it was very good. Lots of them were excellent books and helped lots of people. And they had lots of good ideas. And I met all the authors of all the books in the market in those meetings I go to. I meet them all the time. you know, and I congratulate him in some of the stuff in their books, and I tell him some parts of their books are wrong, you know, and he should change it. So, Syndrome X, basically, we find that that people become resistant to sugar. And they become resistant to carbohydrates, starches. Maybe you getting lost a little bit, but I'm going to take you back inside your body. I'm going to draw a picture of your body and take you inside. Your body is made from a skeleton that looks like this. Not that crooked, but we can fix it. We can do plastic surgery and make it better. Now, this skeleton made from what? Many millions of, and each cell does what? Each bone cell, what does it do? It gets food from outside, and it produces energy inside, plus waste, and the toxin comes out. We discovered that time in 1968, 69. I gave the first lecture on that, and I met the professor from Harvard in the meeting in San Diego 2 months ago, who actually I read his paper to give my lecture from after all these years when we met each other. And I congratulated him that time because you're the one, you and Linus Pauling, I read your paper. He said, oh my gosh, that's a long time ago. Okay, so we know that food to enter the cell must have guys sitting in the membrane right here of the cell with hands. They have hands like this. They put their hands in the blood and they grab the food, put it inside the cell. Are you following me or no? We said that many times before, but due to the lack of memory optimizer in your diet and the lack of acuity and ginkgo and all that, you might forget sometimes. So I'm repeating it to you that those guys right here, we named them vitamin what? E. Let me say it for you. Okay, vitamin E. We said that in 1968, that the vitamin, now we have identified that this hand of vitamin E and those hands coming out, we call them cell receptors. Means they receive food. And inside the cell, if you remember, I doubt if you do, but if you remember, I'm going to try again. This was said 1971, that inside the cell there is a nucleus with a guy sitting inside like a Buddha right there. I repeated the word, so you remember it from old lecture. His name is DNA, and he's the father of the cell, and he tells the cell what to do. You remember that now? Okay, I'm glad you do. So, around him, there is a laboratory called the mitochondria with a chemist sitting right here called ATP and shelves to put the supplements on. And he wakes up, wake up at 4 o'clock in the morning every morning. And while you sleep, he wake up. And then he will send a guy, a messenger, with a shopping list in his hand. 1971, I called it RNA messenger, if you have the old tapes. Right now, we identify it as GLUT4, G-L-U-T number 4. He sent him with a shopping list. Tell this guy right here, I want some food. What's food made of? Food made of protein, sugar, fatty acids, water, and many things. So he said, what is the only source, the main source of energy in the human body? What is the main source of energy of the human body? What's a nutrient that gives you the most energy in the body? Sugar. Sugar. 70% of the sugar you eat every day are carbohydrate consumed by the brain, by the way. The brain consumes 70% of the sugar, even 40% of the body made of muscles. 40% of the body made of muscles, and they consume the other 28%, and the rest of the body consumes 2% of sugar. So this guy here send this guy here to this guy here, and that guy here, he wants sugar. He looks for sugar. He can't touch the sugar. The sugar is too sweet. Then here comes another guy, comes in the blood like here, and his name is insulin, and he grabs the sugar and hands it to him. And he puts it inside the cell, and it goes inside the mitochondria, inside the furnace, blew up, heat comes, and you have lots of energy, and you wake up with lots of energy, and you're ready to go with tons of energy. Why? Because you lived before the year 1800, and your diet was good, and you didn't have any problems, so you have lots of energy. You will wake up and go hunting and go fishing and go this and go do that. You can chase buffalo, you can chase elephant, you can do anything you want. Since Adam until today, we are the supreme race on this earth because God said so. We tell that to the animals when we kill them. We tell the cows and the deers, I kill you to eat you because God said so. Which is true. They are to serve us. We don't serve them. So I'm not going to tell that to my horse tomorrow. Yeah, I do. I'm going to take an apple with me. Okay. So anyway, this is how energy produced every single day. If we don't have enough insulin, what will happen to the energy? We'll be down. We have a disease called low blood sugar, hypoglycemia, right? If we don't have enough sugar, what we'll have? Low energy, right? We have also hypoglycemia, correct? If we don't have the messenger here, what we'll have? Low blood sugar, also what? Hypoglycemia, low sugar, low energy. If we don't have this guy chemist here to burn it, would we have energy? No. This is called Syndrome X. Syndrome X, when you have so much insulin in the blood and so much sugar in the blood, and you cannot have energy. You have so much sugar, you have so much insulin, but you cannot have energy. You're tired. And the only way you can get some energy by eating something sweet right away so you can have energy. 10 minutes later, all right, you're tired again. Another chocolate, you're tired again. Another juice, you're tired again. Another Coke, you're tired again. Right or wrong? That's a pattern of hypoglycemia, of energy. So we call the disease insulin resistant. That there is something wrong, the insulin does not attach to the cell. So the blood sugar goes up or down? The blood sugar is up, outside in the blood. The inside the cell sugar goes up or down. So in diabetic patients, they have high blood sugar in the blood and low blood sugar inside the cell. That's why they're tired. In hypoglycemic patients, which most of women have, they have low blood sugar in the blood if they don't have syndrome X, and they have low blood sugar inside. But 99% of the women in industrialized countries, they have syndrome X. And here we are here today to reverse it. If I came to give you a lecture today to make you miserable, like in the days of Bob Dylan and John Paez when they sing and they make everybody cry, no, we came here with hope. When you laugh, you age yourself. You remember that. So anyway, the problem here came from the following. In the year 1820, exact, Before 1820, let me see if I, how much I have. Oh, great, that's good. Extend the time a little bit. Okay, before 1820, your great-great-great-grandparents who were farmers, they came to this country, or they're in Europe, or they're any place in the world, to get some food for the family. They go to hunt and gather leaves and branches and wood and roots and carry it. And during the way, they eat some roots and some or piece of the meat or something and get home, right? That's how they call gather hunters, right? Now, before 1820, they decided to get big stones and then put them in the river and let them grind the mill with the water, so-called the mill. That's why we get the wheat and the corn and we dump it and goes in between the stones and the flour comes out. Have you ever read about you remember that, right? Or you read about that? But when we went at 1820, the Pillsbury brothers in Minnesota, they decided there is a problem here. Every time you go to the mill with the flours, a week later it spoils, or 2 weeks later it spoils, it ferments, or get moldy. I remember my mother, every single week, 6 boys, we must take the animals, the horses or the camels, and put the wheat on it and go to the mill by the river and grind them and bring them back that day. With no salary involved or no dollar or no bribes or anything. We just love to do it. And the next week, we run out because we only made for the week, then we do another. And it goes on year after year for 10,000 years. Egypt's still doing it until today. The stone mill's still going on until today in the countryside. In the city like United States and Europe, they said, no, we don't want to use stones. We're going to use rollers, steel rollers, and squeeze the wheat between them and the corn and extract the bran from the wheat germ, from the oil, and we have white flour, and we have bran, and we have wheat germ oil. And the white flour can sit in the market for 1,000 years, it doesn't spoil. That's what it does, right? So what happened? It became popular because the whole world loves it. And we start to see rise a little bit in diabetes. How do I know that? Because it's so easy. We went England, France, and those countries that invaded the world and terrorized the whole world with their armies. Every soldier have a diary. We went to the record to check their health. None of them had diabetes. None of them had any problem with their health. They all were fit. By 1820, we start seeing soldiers with a disease called diabetes mellitus, sweet urine. But before that, it didn't. So, what happened to that? How did the diabetes develop in the human race 1820? By consuming what? White flour. Because if you eat corn on the cob with your teeth, only 20% of that will be absorbed. It doesn't matter how much you chew it. 20% of the starch will go in the blood. 80% will come out. That's your capacity. Your teeth cannot do more than that. Are you following me or no? But if you get the corn on the cob and squash it between the steel rollers, you will absorb how much? 100% of the flour. Does it make a difference? 20% from 100%. If you want to know if it does make a difference or not, let us look at the stomach. Here is the stomach, receiving food from upstairs right here. This is your tongue. and this is your brain, and this is the pancreas, this is the liver, and inside the tongue right here, there are guys sitting here. If they taste something sweet, they tell the brain the guy ate sugar. Right here in the stomach, there's a guy sits in a chair with a binocular, and he looks upstairs, and he have a phone next to him, old-fashioned phone, and once he see a piece of flour, let's go to the grain, the corn on the cob. It's corn on the cob. He tell it comes right here, and he tell the brain there is a corn coming, and the brain tell the pancreas make some insulin, a little bit of insulin. Only corn on the cob. Make just a little bit of insulin. And this corn on the cob gets digested and broken down to what? Glucose. And the glucose goes inside the liver, which the liver checks it out and be sure it is not too much, is not you need too much, and so on. And the sugar send the glucose to the cell to go inside with some insulin. This is a good scenario right here. Let's go to another scenario now. Let's go with the white flour. White flour. It's coming in. So this guy see we got white flour or brown bread. Even dark flour is the same. Don't fool yourself. 99% of the bread called whole wheat is just white flour. Unless you can see the grain physically with your eye or part of it. You follow me? You got to see it to say yes, it is made from a whole grain. And white flour comes in. What happened to this guy? He tell the brain tell to the pancreas what? Make lots of insulin. So lots of insulin coming out. And there's lots of what going in? Glucose. Why is the liver there? Why did God put the liver right here, this area? The liver is the largest organ in the body after the skin. The organ is huge. You know, it goes from above the ribs here, about like 5 inches below the rib, and all the way across to the other side. That is the liver. What does the liver do? Monitors all the food. You got to think about the Creator. If the Creator was there as smart, He will do that. Because if Adam was going to be created, which we believe that, and Eve, and they come to earth, and they eat the wrong plant, cactus or something poisonous, and die, we are lost. And Satan will be laughing. Right or wrong? No, we are well designed. We have a liver, but the liver is getting lots of what now? Sugar. When it gets a lot of sugar, there are guys sitting here in those houses in both sides of the street, and they sit and they have hands like this and tongues, and they taste the blood. And they taste the blood, they find it too sweet. Immediately, everyone has a phone. They tell the liver itself, they don't go outside of the liver. Liver is huge, its own company. They don't have to go depend on the brain. Who needs the brain there? The liver tell the liver itself, this guy tell the liver, we got so much sugar. He said, oh, don't worry about it. I'm going to make it too fat. He make it too fat, and he release it in the blood. Fat in the blood. It's called triglycerides. Okay? The white blood cells see that. White blood cells say, what is this? We're not used to see fat in the blood. This thing starts. Oh. We're not used to see fat in the blood, so they gobble the fat, and they go store it in the belly, right here, in the hips, under the skin. They pack it every place. But after they pack so much of it, and the waist gets bigger and bigger and bigger, they start blowing up, vomiting themselves. They vomit fat. Themselves blow up. Well, when they release new fat, that's called new fat. Now we have the old fat, triglyceride. Now we have another process in the liver called novo lipogenesis, or new lipogenesis, or new fat coming out from the fat cells in the blood, and that's called non-esterified fat. A fat that cannot be broken down. A fat that, like plastic, nobody can destroy it. A fat that means no, you cannot even burn it. Because esterification means you can burn it. That goes in the cell right here, if we find it. Right here, it comes in. The first fat comes out from the liver, will cover the cell. So can the cell get energy or no if we are overweight? Did the new fat, because we have so much fat, and some of it blew up, comes out in the bloodstream. It's called novo lipogenesis. It's a new fat called non-esterified fat. Is very, very poisonous fat. It's called small, dense LDL, which none of your doctor even know about. When he does LDL and HDL, he doesn't even know what the small, dense LDL is. This is why when people come to you and said, we're going to analyze your blood, do this, just wait, don't save your money. Because 90% of what you're getting from them is going to be normal anyway. We must look for the specifics when we analyze people these days. So we have a new fat, and the new fat comes in and make another layer. So the problem got to be very severe. So the cell starving, you're waking up at 4 o'clock in the morning, there is no sugar coming in, you're really tired, you want to go back to sleep because you're tired, there's no sugar coming. Then you try to eat something sweet, you try to do this, you get energy for 1 hour, you're tired again. You're tired again. And the pancreas secretes what? More what? More insulin. And insulin is poison to the body. And sugar is poison to the body. And fat is poison to the body. And non-esterified fat, triglyceride, is poison to the body. Are you following me a little bit at a time right here? This called syndrome X. Means insulin resistant. So there are books about it. Says, okay, let us eat less fat. And that is the biggest mistake the government did in the United States in 1970. 1970, they found cholesterol to be high, so they blame everything on cholesterol. Did you hear me say cholesterol today? There's not even cholesterol there. It's fat. So they blame it, and we have a new diet, 1970s, low-fat diet, low-fat milk, low-fat this, low-fat this, low-fat this, but the people still getting fat. Are you following me or no? So let us go back to this curve again and see what happened. By 1870, another company developed corn syrup. And now, not only you can have starches, all you want, and macaroni and spaghetti and potatoes, now also you can have syrup and sugar in any amount you want. You can have pancake even. You follow me? And put syrup on it. Then we liked it. Because disease takes sometimes one generation, another generation. Because I'm going to explain to you later, the problem is more than one generation because there's mutations happening here. And that's not in any book yet. The last part of the lecture is not in any book yet. It's not published yet. From University of Colorado will be published in May. So the 1870 maple syrup came through the whole Western world. The diabetes went like this. With the diabetes go on, the sugar went up in the blood. Sugar also convert to alcohol in the blood, called sorbitol. Sweet blood, sorbitol, kills nerves, kills the brain. So we have a problem with Alzheimer's disease. We have amyloid, we have a sludge buildup inside the brain. We have problems through the whole body. And then we have problem in arteries in every place. And then I just want to finish with the history, and I show you pictures. Then by 1970, Coca-Cola company and Pepsi-Cola company, they came out with another sugar, a new sugar. No, corn syrup made from 99% glucose and 1% fructose. Are you following me? And fructose is 20 times sweeter than glucose. They managed to extract fructose, convert to glucose to fructose, and put it in the market as 50-50 fructose, or 95-5 fructose, or 45-65 fructose. And cereal company loved it. Started putting in cereal, chocolate, everything became so sweet, and they save money. For every can of Coke, and there's 10 teaspoons of a new sugar called what? I didn't say glucose. Remember that. Now we are moving from sugar to a new sugar. Are you following me, or are you falling to sleep? We loved it because kids loved it, university loved it. Coke. They gain weight, then Diet Coke, give them aspartame, give them this, then have brain tumors. So what happened? We start fighting it. By the year 2004, the level is going up. Diabetes, insulin resistance, weight, everything. With it, many diseases. I think you understand already that when you have high blood sugar, you have high fat, you have many diseases, right? You're going to have heart disease, right or wrong? You're going to have many diseases. I want to show some of those diseases, what they look like. Now, we looked at the arteries of the kids. This is an artery from a 47 years old man. Right here, all this is the right leg, left leg. You see the blood clots, you see all the blockages in it. This is all the fatty deposits in the cells. We have another one from 33 years old. Right here was fat all over his arteries, and he died from it with a heart attack. Another one from 27 years old. And all the fat, the red stuff right there. So the fat we have in our body came from where? Sugar. It did not come, all of it, from fat. It is true that fat is not good for you, saturated fat, but not too many people enjoy drinking a glass of fat. But people enjoy drinking a glass of sugar. And what happens if you eat a fruit instead of, what happens if you eat a fruit? Let's see an apple coming in. Here is an apple, came from the Garden of Eden and fell down right here in front of Adam, and he ate it. Only 20% of the apple becomes sugar in the liver, and 80% passes through, like the also. Only 20% of the oranges, 40% of the bananas, 10% of the watermelon. We call that the glucose index. You heard about glucose index? Okay. Glycemic index? Maybe you heard of that. Glycemic index is when you buy something, you have to look how much glycemic index it have in it. The higher, the worse. The lower, the better. Anybody here heard about glycemic index? Okay. But 1996, we decided we're not going to follow the glycemic index. We have something called glycemic load came out. That because it was not really correct index, because watermelon was very sweet, and then the glycemic index took 80%, 90% under sugar, right there, and when we studied in the liver, it's only 10% in the liver. So the glycemic load was very low for watermelon. All the fruits were very low, all the vegetables were very low. But the bread was what? Was very high. But right here, we don't have glucose, now we have fructose coming. Fructose works in the liver. Look what happened. These guys here, they don't know who is this, fructose. They couldn't identify it. But the liver is a detoxifier, right? The liver has an enzyme, glucophosphokinase, that breaks down sugar, glucose to energy and so on and so on, in Krebs cycle. However, it didn't see fructose before, so it doesn't know what to do. Then the liver said, okay, I'm going to make it worse for this person. I will convert fructose to VLDL, very low density lipoprotein. And VLDL carries all the triglycerides. When it goes in the blood, loves fat, takes all the fat with it. So VLDL comes from fructose, and when it goes in the blood, it changes some of it to palmitic acid. It becomes VLDL palmitic acid, and it goes inside the cell right here. How did it go inside the cell? I have no idea. We don't know. The person who's going to discover how fructose goes inside the cell, how to solve syndrome X, will win Nobel Prize. And the physician that I work with in Colorado, he probably going to be one of my colleagues in American Medical Association. He probably one of those people who will win the Nobel Prize, and he only 34 years old. He's very smart. How this go inside, we don't know. It goes inside. VLDL goes inside the cell, and we look inside the cell, we find that the cell inside, this is the human cell, what it looks like right there. That's what the cell looks like before it gets poisoned. This is after it gets poisoned, it looks like this. Okay? It goes inside and it converts to another compound called celamide. It's a chemical. Then celamide, where does it go? To the DNA, open the nucleus and attack the DNA itself and cause mutation. Then when you have diabetes, your child will have diabetes. When you have a heart disease, your child will have a heart disease. That's how we inherit the diseases, because our ancestors have done so much damage to us, and we still continue to do it to ourselves, that we must change that. So this is why we are in the situation we are in. If we look at the cell inside, and we just have to skip through lots of papers, this is a picture of a cell inside. What do you see inside the cell? What are those droplets here? All fat. Look how much fat inside the cell. This is 70% of us right now have that syndrome. Or maybe 80%, maybe 90%. If your weight over 15 pounds, you might have it. If your triglyceride high, you will have it. If your blood sugar over 110, I would say 100, you will have it. If you have diabetes, you will have it. If you have low blood sugar, that you're actually eating good, but you're still hungry, you probably have it. If you have VLDL, you probably have it. If you have heart disease, you have it. If you have this right here, you have it. If you have skin spots on your skin, age spots, we all have it, right? Inside the brain, what does it look? It looks like this. Age spots in your skin signal that brown slime inside the brain. What is the brown slime in the brain? It's all fatty amyloid deposits. Causes Alzheimer, causes Parkinson, multiple sclerosis, and all of these diseases. So, once they go inside the body, they will go to the DNA. This is the DNA. And how many minutes do I have? 23 minutes. Okay. Okay. But 23 minutes for the CD? For whatever. This is the DNA. And for your news, all of you right here, we already, United States of America and the world, we already succeeded of figuring the human genome. It took 13 years to do. We already finished with it. We know every gene inside the body right now in the human race. But there are secrets we don't know. We know that every gene, 25,000 genes are there, 46 chromosomes, 25,000 genes, we know. But why only 2% of the chromosome occupied by gene and the 98% we don't know what it is? That's a secret, we don't know what it is. But inside the nucleus, right, our nucleus inside, we fight back. Our DNA right here is already start mutating. Means what? Mutating means splitting, right? Means splitting to two. Because the DNA have a certain code, right here, this code, and the chemical came from outside, the fructose, and the sugar, and the fat damage the gene, and the gene, and the gene. So, we must have diabetes children, and we must just die slowly, and 70% diabetic is spreading so rapidly right now in society. You know that or not? Very, very rapidly. In the other countries who don't have the same thing, they don't have it. They have it in the cities where, like Cairo, New Delhi, they eat like us, they have the same disease. But you go in the mountains, they don't even know. I went to my village in Egypt with my kids one time. The people in the village never been in the city, never saw electricity all their life. Because that's how they lived for 10,000 years. They said, we don't need the city. They still have people graduate like me, but they still know, but we like to live like this. Farming by hand, by this, we don't want. My uncle bought a tractor one time so he can have a tractor in the village. And they put dirt in the gas tank for him. And he was the mayor too of the village. And my cousin came to tell him, your machine made so much noise last night, I couldn't sleep, I had to put dirt to stop it. And he told them, okay, I get rid of it. See how people relate to each other? It bothered you? I'm sorry. It's not a crime. It's my crime. You didn't do anything wrong. This was my fault. That's what my uncle, he died down, he was the mayor. He said, he told my nephew, he told my cousin, he said, you didn't do wrong, I did wrong. Because the whole village sleeps at 7 o'clock, 8 o'clock, wake up at 4 in the morning and hear a machine running all night for the first time. Noise, he didn't like it, they wake up, they find where's this machine. They put some stuff in it until they find something to kill it with. Now, we discover something 1996. that we found there are beta-carotenes right here, there are quercetins right here, there are bioflavonoids right here, the flavomax right here, vitamin E right here, and vitamin C inside the nucleus that can correct this gene, but don't make a mistake. I just came from a conference in UC Irvine about that subject only 2 weeks ago. It will take very large amount of supplement to correct one gene. So the new nutrition gonna be in the future is gonna be nutrigenomic. Means we're gonna be able to analyze a person's genes, find out what's the mistakes, give him the proper supplement for his gene. And the rest of the supplement will be just minimal amount. You understand? That is the greatest news we ever. Harvard discovered it. Shaklee came out with the cholesterol regulation, the glucose regulation, the DTX, which now we find out that what Shaklee came out with is actually what went inside the cell to correct the problem. Except we don't know the quantity yet. In my clinic, we do what we call megavitamin therapy. And we noticed 1978, when a patient came to me blind with multiple sclerosis, we didn't know multiple sclerosis at that time, we give him so much vitamins, see what happened, if they're going to live or die. And the disease was reversed. But no paper was published. So right now we know that we can reverse some of these things if we take. It doesn't mean you should take a mega vitamin of every single vitamin. Does it mean, did I say that? You can't say that. You're going to say, I'm going to take 100 of C, 100 of B, 100 of E. You know, your stomach will be full. And when I was to take 40 vitamins and I was happy with it, and one day, 8 years ago, 9 years ago, I thought I might have cancer in my prostate. Then I doubled the amount. It turned out I didn't, but I doubled the amount. The first time I doubled it, I put it in my mouth, and it came out, hit the wall. You know, I said, oh my gosh, I'm going to eat that stuff. But my brain played tricks, said, no, but you're going to die from cancer. So next batch, I swallowed it right away because the brain said, oh no, we don't want to die. So you need to take lots of vitamins, true, but you don't have to wait for the proof. Shaklee Company came in the top of the world to produce such a product to the world in different kind of forms. But before we go, what should we do? Let us look at pictures of things that we should know. This is the musculoskeletal system of the body. That's the muscles right here. This is the back of that person. And this is the front. No, I'm just kidding. You believed it for a while. Okay. You see how much muscles we have? Why do we have then flabby muscles? Is it the fat we eat every day? Was it? I just talked about it. Was it even the exercise? It was not. It was the amount of white flour and sugar you consumed all your life, and your parents and your grandparents. So that will accumulate in the muscle, and the muscle is a huge place to store energy. Because what's energy comes with, muscles makes energy. That's how you move with muscles. Heart is a muscle, arteries are muscles. So the cells of the body also, I just put them here by mistake. The body also has cells inside it. And the cells, some of it looks like this, like that, like this, like that, like this. They are called specialized cells. Those cells also need sugar. They need energy. When syndrome X affects them, there is another problem happen. Let us go back to this calendar, that curve that I thought I'm not going to need it, and then I threw it away, and now I need it. That curve, all right, here it is. That curve right here, we have noticed something from 1820 to 2004 didn't happen before. Before 1820, girls had the menarche, the period, at the age of 16 through the whole world. Now, it's the age of 11 to 12. Why? Could it be that the amount of sugar was going inside the body done something inside the liver? Let us go to the liver and ask him. What did he do? Here comes the criminal right here, the liver. What did you do? We find out, besides he's making all of this, he's secreting IGF-1, insulin growth factor 1. And insulin growth factor 1 is what makes you grow as a baby until you become 5'6" or 6 foot tall. You know, that's normal. But you're supposed to grow and stop growing. So anytime you injure your hand, you cut yourself, whatever, then the liver puts insulin growth factor so you grow back like you were before. But the insulin growth factor 1, when it comes out, the liver also secretes anti-insulin growth factor 1 protein. You got the point. It secretes something for you to grow and secretes something for you to stop growing. The liver, when there's so much sugar, it does not secrete the other protein. When you measure it in the blood, insulin growth factor is high, anti is low. So if you're the doctor and I'm a patient, and you measure IGF-1 in my blood, and you find it high, what should you tell me is going to happen to me? Remember, let me just go back again. IGF-1 makes you grow, but it's the most mutagenic hormone in the whole body. You know what mutagenic means? Mutation. It's the hormone makes the most cancer. Makes cell grow, double, multiply. So if I have lots of it and I'm a kid growing, my eyeballs start growing fast. So what happened to my vision? I can't see, then I go to the doctor, then I have myopia. Then I need glasses. Do we see more kids with glasses? That is right. So myopia start happening. So menarche went down, myopia will start going up, right here. And another problem, boys and girls, both of them start getting taller. Before 1820, the average boy 5'6", girl 5'3". Now it's 5'9" and 5'6". That's 3 inches of growth happened. Does IGF-1 makes growth or not? Are you following me or no? So the taller the person gets, the more IGF-1 he have, the more disease he will develop. And the more cancer he will have. Okay, I prove it to you. Taller girls has more myopia than the girls who are shorter. They have more polycystic ovaries than the one who are not taller. They have more cancer of the breast than the shorter ones. This has all been studied. Oh, I didn't know I was asleep. Okay, so this is what we have noticed. There is mutation going on, but there is even more mutation going on. Let me tell you about another one. Here, ovaries and testicles. The testicles secrete so much testosterone early age that there is so much hormone coming out that the cells of the skin of the boy grow so rapidly that the hair cannot breathe. There is a lots of acne. So acne is related to syndrome X. The first paper ever published, dermatologists hated it. In their paper was last month. They always denied nutrition has anything to do with acne until we published a paper in their own magazine to show them, yes, it is related to sugar. Then the girls, polycystic ovary, infertility, in vitro fertilizations is very common, right or wrong? Now we go to polyps. Polyps of the colon is become more common than before. What does polyps come from? Cells of the intestine that start to growing longer. That's polyp, right? How about with aging we have skin tags? They're very harmless. They don't cause any problem. But why do we have them? Because insulin growth factor, if you take a piece of it, analyze it, is full of epithelial growth factor, which comes of insulin growth factor hormone related to it. And skin cancer is the same thing. Now we're going to come to a very sensitive subject, which is the cancer itself. And there's no book published about it yet. And this will be published in May, that cancer itself is related to sugar and white flour. If it is true that cancer itself is related to other things, let me find some more transparency as here. Okay. Cancer itself is multiplication, that the DNA itself gets multiplying. And I showed you a picture of a DNA earlier, which I probably cannot find it, is the DNA was multiplying. You've seen that, right? Cancer is multiplication. And we find out there's a correlation between syndrome X, consumption of sugar, consumption of fructose, Diet Coke, Pepsi, and all of that, and cancer. So what we should do? First of all, number one, you should make a diagnosis. Do you have syndrome X or not? There is blood test to be done. 2-hour insulin blood test. Every 15 minutes blood should be taken and glucose be taken. We can do that. We can measure the sugar. We can triglyceride, the VLDL. We can measure insulin growth factor 1. We can measure the obesity around the waist. We can measure, do you have heart attack, heart disease? Do your parents have diabetes? You know, all it takes two of those things, all it takes 2 of those factors to get you to be a syndrome X anyway. So 70% of our killer diseases related to something we didn't know for all that time because we refused to recognize sugar and sweets and white flour as poisonous to us. But now, how come doctors don't know about it? Because it's hidden. It's published. I read over 5,000 pages on syndrome X. And you go on the computer, you see lots of things about it. Why doctors don't know about it? Because it's one of those things that if you be known, industry is going to get hurt. The young man in Boston Children's Hospital who discovered fructose in Coke, and he said that causes all these problems, his condominium was trashed at night. Okay. So what can we do? We need the proper diagnosis. Diagnosis can be heart diagnosis. When Clinton had his heart attack, I went ahead, I had a nuclear scan of my heart in my own machine. It says my heart is perfect. A company come from Germany brought another machine. We checked my heart, said, no, you have 20% of blockage. So we need new technology. We cannot use old technology. New blood test, new things, and there's no one person knows everything except God. Number 2, the diet. Protein is extremely important in the diet of syndrome X. You must consume large amount of soy protein mix, the Shaklee soy protein mix every day. Because if you take the Energize or the Slim Plan, they do have carbohydrates in it. Are you following me or not? The soy mix. People say it doesn't taste good. I don't care how it tastes. You have to take it. But that's not the only protein you should take. Beef, lean beef, organic, is excellent for the human body. Lean chicken, wild chicken roaming, is excellent. Salmon, wild salmon, is excellent. Cod liver, cod is good. Mackerel is good. Sardines are good. All of these things are good for us because they do have omega-3 and they do benefit the human body. So we must have the vegetable protein from Shaklee soy protein plus other protein. Number 2, the carbohydrates. Carbohydrates, we need some. How can I give you all the carbohydrates you want that you will have no problem with your energy? Just eat fruits all day. Fruits in the morning, 10 o'clock, 12 o'clock, 3 o'clock, 5 o'clock, 10 o'clock, whatever, you're only going to absorb 20% anyway. And I have people on diet with fruits and protein, and they're losing weight with no exercise. So imagine when they start exercising them. But the amount of protein they consume is about 9 to 12 tablespoons of soy mix every day, plus fruits. We don't tell the people how much fruits. We let them handle it themselves. Just buy it when it's cheap. Okay, fat, pay attention to olive oil. Vitamins, take all the Shaklee vitamins you can get. Water, good water with reverse osmosis, and minerals and fiber. The other factors is control stress and control toxicity. In toxicity, we have to remove the LDL, the VLDL, the homocysteine, the C-reactive protein, all the chemicals from the body. We do that by a process called methylation, intravenous plus oral. We give lots of Shaklee B complex and Vitalia and all of that. Plus we give other stuff to try to dissolve the sludge out. That's what we try to do. And the last thing I want to tell you right now, I'm going to give you my phone number, which is 847-571-3914. That's my cellular number if you have any question. And 847-356-9009. And that's my office if you have any questions. This concludes the lecture for tonight on Syndrome X, because we decided to have the CD, which is 80 minutes, and easy to have one rather than have two, and become also cheaper for lots of people. But the lecture will continue because there's a DVD also going on. You know, that's going to go for how many more minutes? The DVD. 40 more? 40 minutes more? I'm not going to do that. What do you think? I have to go to the bathroom or something. No. I'm going to lecture someplace else. Anyway, that's fine. We wanted to spend as much time as possible to discuss things. We discussed the major thing to go on the tape that somebody plugs it in, you can make copies and give it to people. In the tape, we need to talk about the cholesterol regulation complex. What does it do? The cholesterol regulation complex, it has in it several products that are very important to the body. And those products, when we have given it to our patients, we have noticed their cholesterol was lowered than Lipitrol. Yeah, it was better than Lipitrol in lowering their cholesterol. The glucose regulation complex, however, was become very important because it has so many things in it that helps the body to assimilate glucose. You don't want to know everyone. You can ask Shaklee Company. The chromium, the magnesium, the manganese, the zinc, the alpha-lipoic acid, the taurine, all the stuff. Very, very important to help the insulin inside the body. But the one I like to bring to the lecture that is sort of forgotten is the DTX. The DTX works where? In the liver. Where did we find our problems here? In the liver. Let us see what DTX have in it to benefit us, because lots of people are not taking that. The first of all, it has in it celibin flavonoid, which is called celmerian. It has flavones. It stimulates the liver rejuvenation of damaged cell, speed recovery from toxicity from fructose, kills viruses in hepatitis C, gets rid of the VLDL, is powerful antioxidant. DTX prevents gallbladder stones by reducing cholesterol in the bile. DTX also increases urine output, is diuretic. It helps with digestive system and also maybe help to shut this alarm. Okay, let me figure it out. All right, here it is. I'll put it in my pocket. Nobody can see it. Okay. Also, it does relieve constipation, not like Herblax, but close. It lowers blood pressure, which help in syndrome X. Increases milk flow in women who breastfeeding. Decreases endometriosis in women who have problem with it. Inhibits it inhibits certain carcinogens inside the liver. It has also, I just want to show you why, Shaklee, when they make a product, they go through so much to make the best formula, and they continue to improve on it. They have also inulin in it, which convert fructose back to glucose. And that was something we discovered recently. Shaklee had the DTX before the discovery was made. It has also pectin, which lowers the cholesterol and also help against diarrhea. It has coumestrol, coumestrol, which is phytoestrogen, which is anti-cancer. It also have another herb, Schizandra, which is similar to celmerian. It does similar thing. It has also the mushroom, reishi mushroom, which is anti-inflammatory, help the liver, and also help asthma patient. It lowers the cholesterol, lowers the blood pressure, help the kidney, and decreases stress, and help to fight infections. So I just want to be sure that part of the lecture has been covered. Okay, now I'm going to give you a chance to ask questions as long as we have 2 hours to go yet. So we just, the hotel reserve rooms for us here. Okay, now let's see if I have anything I didn't show you. This is a picture right here for a 28 years old boy that shows the artery in the right leg completely blocked. He has syndrome X also. And for some of you who are so smart, and when you tell them you need to have the proper heart test, and he said, I got a stress test, and my doctor said, I'm fine. You tell them that lots of people got stress tests, and they died on the way home, you know. So, and lots of athletes, when they're running marathons and die, like Floyd, and also some basketball players. When it comes to checking syndrome X, you must check first the heart. The heart is number one. We're going to have a lecture about the heart, circulation. Next time, lecture is going to be about how to improve circulation. But the heart itself, what we've been doing right now, we checked every patient with the new machine over 7 years of age. 70 years. We find they 100% have blockages with the new machine. We went down to 60 years, 100%. We went down to 50 years was 100%. We down to 40 years, still 100%. We have not done 30 years yet. So this means we will have technology eventually to look inside the nucleus. We'll find genes and identify them. We can look inside the heart, find small, tiny blockages that nobody can ever see it. But this machine, right, I hope it doesn't fall in the hand of surgeons and many cardiologists, because they will use that as justification for open heart surgery. Because it's a big business. Because the insurance guy will say, why are you doing the $500,000 surgery? Oh, we did this test. It cost us $2,200 to do it. And we find all of this, and they have to pay. And the whole country go bankrupt this way. So we hope that they don't abuse it. And it looks like they start abusing it already. Lots of doctors calling me that, can we rent the machine because we want to do more surgeries, you know? And we already got calls like that. So we really have to be very, very careful when we make diagnosis, not to abuse, because we have God watching over us, and we do something wrong, we'll pay for it in the end. So stress test itself is wrong 50% of the time, and this was published in very reputable magazines. You seen that before or no? Okay, it says stress tests aimed at detecting blocked arteries could miss more than half of the cases. Because, you know, you don't have to have blocked artery to die. You could have a stress, spasm. Somebody upset you so much that your artery goes like this, like migraine headaches, you know, then you have a heart attack. So even a 6 years old can have a heart attack if you give him enough stress. So we need to be careful that if we want to check the heart, we must check the heart with this new cardiolite machine that most of Medicare pays for it, number one, and most of insurance company, they pay for it. But because insurance company realize good for them, that they know early that we can give the patient the diet and the exercise and this, and then we can avoid many surgeries in the future. I have taken, this is a picture right here of my own heart when I did one of the heart tests. And these are the arteries. Let me just be sure to put my name in the right place. So you say, yeah, he is, says Mohamed Nasr right here, right there. And the arteries right here, we look through it, and we find a little bit blockage. And that's another machine. It detects bigger blockage. This detects anything over 10%, 15%. The other detects anything below 10%. So I had to go for that to see how bad things are. And that's the heart itself. My heart, I showed it to you in the past. Yeah, it's like this, right here in the name. And then we see, if we look at the artery, there's a plaque right there, and there's another plaque right there. And in here, right here, there's maybe one right there. Very little. And that made me go and take and start checking the homocysteine and C-reactive protein. I did all of the stuff to start lowering everything, and hopefully by next year, everything goes back to normal. Even a blockage is only 20%. It's still important that I have to treat the patient the way, treat myself the way I treat my patients. Okay, few advices. If you want to check your blood for other things like for syndrome X, you have to check fibrinogen, C-reactive protein, homocysteine, glucose, iron, cholesterol, LDL, HDL, triglyceride, DHEA. This article was published before VLDL was discovered, and this is 2 years old, and also before the non-esterified fatty acids was discovered. So that's it for you tonight for the lecture. I'm going to take some questions. Yes. The what? Low DHEA. You replace it. You have a question? Correct. Oh, no, not in the fruit at all, not at all. Because we find that the fructose manufactured is really different species of fructose. It doesn't even look like the natural one. It's more concentrated, doesn't look the same, doesn't act the same. Okay, I want to tell you one experiment that to convince some of you who are not convinced about anything. In Switzerland, they had pigs, experiment. They had pigs, they feed them, they feed them protein all day, just protein all day, 100% protein. They have another group of pigs, they feed them fat all day, just all day eat fat, 100% fat. They measured the cholesterol, it was normal. They measured the triglycerides, it was normal in the pigs. They give them intravenous fructose. It went up by 2,000%. They shut the IV in 1 month. It went down to normal within a month. So there's no doubt the fructose is the culprit in syndrome X. Sugar is bad too, white flour is bad too, but I think Coke and Pepsi should be aware of that, and they should stop putting fructose in it. They should stop doing lots of things, because even the artificial sweetener, NutraSweet, also causes lots of problems. So I don't know how you fight industry. You know, money talks. When I went to Washington, I was sitting at a table with many congressmen. One guy sitting next to me, and he has so much money you won't believe, you know, and he's just talking to the senators and Congress like he's ordering them what to do, you know. So that's what I see with my eyes, and I hope I can make some difference over there. Fox TV asked me, what are you doing here? I came here, hopefully I can make some change, you know. So any other questions? I'll be with you. Yes. Splenda, I know nothing about it. Splenda tastes like sugar, and looks like sugar, smells like sugar. If anything tastes like sugar, smells like sugar, then it's not sugar. I tasted it with my tongue. It tasted exactly like sugar. I'm a chemist. I really think this is an isomer of the sugar, because I want to tell you this about Splenda. If you look at sugar, like fructose or sucrose or glucose, you look at the natural sugar, it looks like this in the chemistry, like that. Now, if you look at Splenda, it looks like this. Does this look like this? It does look like it. Is it the same? No. This is a mirror image of that. So when you look at the mirror in the morning, do you see yourself or you see somebody who looks like you? I'm getting confused now, right? Okay. Well, you will see somebody look like you, because when you raise your right hand, the person in the mirror using his left hand. So we call that an isomer. It looks like it. That's the difference between Shaklee supplements and others. They are the isomers of Shaklee. They look like it, but it's not the same. Some of them are, and some of them are not. I think xylitol is okay, but we don't know much about the metabolism of xylitol in the liver. So I'm really going to say, if I want a sweetener, I'm going to put honey. If I don't want a sweetener, I'm just going to eat fruits. And I don't know much about xylitol yet. I don't know much about other things, because it takes, you know, the research we read right now, sometimes the papers we read right now, it was published, some of them 30 years ago, and was hidden from us until today. Some of the papers we read was published in 1970 and just was released to us this year. Because drug company have the best chemists, the most intelligent chemists in the world they got. And when they discover something, they just can keep it secret. They don't have to even publish it. That's what they did with that medications for arthritis, Vioxx and all of that. And they're going to put it back in the market. Because the government will give them amnesty. They cannot be sued. Like HMO, you cannot sue HMO because the Congress gave him amnesty already. And when I was in Washington, I was telling them, how about the 1 million unknown soldiers serving this country called medical doctors being sued all the time? Or don't you give them amnesty? Said, no, we cannot do that. So that is money talks. And this is why we are losing very, very good doctors to Canada. Some of them going to India, to Europe. Illinois lost 10%, losing 10% of their physician every year. California losing 10% every year. What are you going to do when you have emergency and you need to fix your bones and there's no doctor in the hospital? You follow me? I know there are some bad doctors, but I'm in a profession that to say I belong to the best profession in the world. They have the most honest people in it. And I have not seen dishonest doctor yet. I have seen ignorant doctors, but not dishonest. So I like to answer more questions. Some lady in the back had a question, maybe? Yes, ma'am.